Hello, everyone. Welcome back. The meeting will now come back to order. The next order of business is a report from the LSU HSC Human Development Center. The chair recognizes Ms. Constance Alphonse for the report.
Good afternoon. I am filling in today for Dr. Wilson to give the HDC report. In October, when I was here, I shared about the FASD project that we were going to be working on DCFS trainings across the state. But because of a governor's order to stop training within DCFS, we did not get to do that. But Dr. James, who's coordinating the FASD project, was able to pivot and provide some trainings to some other agencies across the state, really focusing on that coordination with the regional family helping family centers. And then that was information has been and approved by the council. And we're still working to really just kind of review how we can get that training completed with DCFS. We also have been working on federal funding sources. So we have submitted grants to 3 different federal funding. We did a grant with Maria Blanco in the Office of Head Start in an early Head Start partnership. That grant will allow us to continue to provide the training that we already provide for early Head Start and those resources. It also helps support the salaries for about 8 or 10 full-time staff members that we have, and providing professional development features. It also allows us to expand the coverage outside of Orleans Parish, and so we've been able to move into Jefferson Parish as well. Nikki, Dr. Rose Angelosi, and Dr. Jennifer Lentz submitted a grant to the Administration of Community Living with the National Institute on Disability Independent Living Rehabilitation Research to interview parents who are raising children with Usher syndrome, which is one of the most common reasons for deaf blindness. And what they're wanting to get with those interviews is really to identify some of those challenges as a parent and some of those needs. And then from there, improve the effectiveness of those resources for professionals, and to help provide supports for parents who are raising children with Usher syndrome to help really strengthen their success educationally and with community integration and that transition to adulthood. Alec Howitz and Tracy O'Donnell have also submitted a grant to the Administration of Community Living in the National Institute on Disability Independent Living Rehabilitation Research to support transition. And I know that's a topic that we had lots of conversation about for the last 2 days. So with that, it's really the proposal is to work on enhancing that interagency collaboration to kind of reduce those redundancy of services between agents. So what the school districts are providing and then what vocational rehabilitation is providing. And so their specific goal is really to develop tools that will support that collaboration between educators and the vocational rehabilitation counselors to reduce the duplication of those transition services. And they're going to be looking at the CREAT subtopics that are required by the Workforce Innovation and Opportunities Act in those 5 areas to provide individualized instruction. And then we have the final grant was submitted by Logan Guillory, and HDC would be a sub-awardee, and it's a National Institute of Health Small Business Innovation research, and that's really focused on creating a phone-based app for caregivers of children and youth with autism spectrum disorder and related disabilities. And it would include a micro library of video training on common challenges of raising children with autism spectrum disorder and related disabilities. The goal would also be to include a desktop application for support coordinators to use so that they can stay in contact with families and caregivers to kind of ensure that continuity and efficiency. And then our last update, we are working on creating a neurodevelopmental disability clinic. Dr. Michael Norman is working on that and really focusing on bringing in other faculty within our allied health school, and those departments across our LSU Health campus, to create a clinic where what they would do is they would follow this format for assessment. So they'd start with like a brief diagnostic session, to either identify or confirm some specific neurological dysfunctions, such as executive functioning, memory, processing speed. And it's not really, the purpose is not to really diagnose any one condition. So it would look at a range of conditions, but maybe confirm like the underlying cause of the disability, based on a neurological condition. And that is really important because we know that some neurological conditions do not respond to traditional treatments and approaches. And so it also would incorporate an interdisciplinary team to kind of come up with a treatment hypothesis and plans on how to support that individual. And then it would have 3 to 5 clinic sessions included, where they're testing and kind of refining and ruling out hypotheses, to come up with a treatment plan that's kind of individualized. And then the team would come back together to kind of come up with a consensus of the most effective treatment option. And then they include the parent piece in that and would train the parents and caregivers to implement whatever those recommended strategies and approaches are.
Any questions? Any questions? Any public comments? Hearing none, the report requires no action. We placed on file. The next item of business is a report from Louisiana Rehabilitation Services. The chair recognizes Ms. Melissa Bam for the report.
Hi, good afternoon, everybody. My report is on the right paper. I have a lot of statistics in here that y'all can look over. I won't go over those specifically. Wanted to just discuss a couple of things. Under pre-employment transition services, we talked about this a lot in the Education and Employment Committee yesterday. But wanted to mention, we currently have 19 active third-party cooperative arrangements with school districts to provide pre-employment transition services. And we are also, we have 3 school districts that we're in the middle of contract negotiations with. And those are Lincoln, Lafayette, and Catahoula. So we continue to increase the participation in third-party cooperative arrangements, which allows school districts to have their own transition specialists in their schools in order to provide these pre-employment transition services. One thing I did want to note on the bottom of the first page, we have been under a federal corrective action plan because of time limit issues in determining eligibility and writing individualized plan for employment. So that's the statewide 60 and 90-day performance measure. And I'm happy to report last quarter, we were able to meet that target, which the target is 90%. So we are improving and meeting that particular compliance measure. And so hopefully we'll be out from under that corrective action plan soon. Our Louisiana Rehabilitation Council was also supposed to meet last week during the snow event. So it has been rescheduled. It was just rescheduled today for Monday, February the 24th at 9 o'clock. And that'll be at the Hampton Inn on Riga Road. So if anybody's interested in attending, that's when that meeting has been scheduled. Also wanted to mention that we did just conclude at the end of the quarter a training for all of our counseling staff called the VR Journey. We have had, and I've discussed it several times in many of our meetings about our issues with recruitment and retention. And so we have a lot of new staff. And so we thought this was a good opportunity to get everybody together, all of our counselors, to make sure that we're on the same page with, there's a lot of policy with VR services, and we have a lot of different services. So in order to, one of my goals is for our services to be more consistent statewide. And so everybody got the same training. And so hopefully you'll start seeing a little bit more consistency with the services that you see statewide. And my last update is, we did contract with LSU Shreveport Institute for Nonprofit Administration and Research. Every 3 years, we have to conduct a comprehensive statewide needs assessment as part of our state planning process. And so, we conducted that assessment, or we conducted that survey, and they are at this point analyzing the results, to give us that report, which will be used for planning purposes in the future. But that's all of my, comments I want to make, but happy to discuss them.
Any comments or, anything from the board? Council members? Anything from public? Hearing none, the report requires no action to be placed on file. The next item of business is the report of the Office of Aging and Adult Services. The chair recognizes Ms. Richard to present the report.
Very well.
No, Mr. Williams, I'm sorry, Mr. Williams.
It's okay. Good afternoon, everyone. Of course, kind of the same format in the initial meeting that I attended with the group back in October. Kind of goes to our list of our current recipients of programming, adult day healthcare and community choices, waiver, adult day healthcare and community choices. Those are both our waiver programs, as well as the long-term care services and program of all-inclusive care for elderly, the PACE program. I want to make mention of the PACE program. It's been really going well. We have 4 of those programs across the state. The 424 course, that is the total for all 4 locations across the state. Most recent one that opened in Alexandria, it opened in last year in 2024. They had a grand opening last month. No, actually earlier this month. And currently at 54 participants. We're really looking at this PACE program because of the fact that the Community Choices Waiver Program, the wait list is very long with that program. But we found that the PACE program offers an opportunity for seniors and others to go and receive services at these centers and that would otherwise, they would be waiting for a Community Choices Waiver to receive. So those services, we want to make mention, or we want to make it known to leadership as well as legislation, if that we can have some funding to open additional PACE centers across the state, we think will be very beneficial and give us some relief as it relates to, again, those waiting for services through the Community Choices Waiver. One other thing I wanted to point out under the waiver registry, I think I mentioned this back in October, but the CCW wait time at 13.3 years, those that are waiting are receiving some services, whether that be in-home services or services that they are going into a facility to receive. The CCW wait time without any services, that is a shorter time frame because those are not receiving any services at all. We can move down to, just want to highlight the investigations. If you all have any questions on that, please let us know. That continues to be a top priority for the agency in all categories, whether it's caregiver, emotional, financial, physical, sexual. So as Governor's Office of Elderly Affairs mentioned, that's a top priority for both of our agencies. I think we work pretty well in making referrals to one agency to the other as it relates to any allegations of abuse or neglect, whether it's within our age range of 18 to 59, and they're referred to us, or whether it comes to us and they're up over that age range of 59, we make the referral to the Governor's Office of Elderly Affairs. One other thing that I do want to point out is that I know we talked about again back in October, but we have moved forward with the workforce training. We continue to, as everyone I'm sure is aware of, the workforce shortage when it comes to providing services, in-home services. So we have continued to find ways to educate, provide CDUs for direct service workers. So we've continued that. We launched a pilot program for direct service workers to receive training. Direct service workers can sign up for an online learning platform and participate in self-directed learning through November 30th of 2025. And then we, in 2024 and continuing in 2025, we are offering the person-centered thinking training and dementia training at no cost to direct service workers. So we feel like this will go a long way in helping those providers get the training that they need, not only free of charge, but help them gain CEUs that they may need for their positions. So that's really all I have.
Is there any comment from council members? Any public comment? Hearing none, the report requires no action. We place on file. The next item of business is the report of the Office of Public Health. The chair recognizes Ms. Baravecchio for the report.
Hey, good afternoon. My name is Patty Baravecchio, and I represent Title V. The Bureau of Family Health, under the Office of Public Health, administers the Title V program for the state of Louisiana and offers a lot of programs and supports for children and youth with special health care needs. I'm not sure what color. I would think I'm usually bright yellow or orange, and my report is rather lengthy. And so I just want to highlight some very key programs that may be of help to the families that you serve. Children's Special Health Services has a transportation assistance program that if Medicaid transportation is not suitable for the family's need, they must apply to Medicaid transportation first. But if that is not, it does not meet their needs, they can apply for a transportation stipend through Children's Special Health Services. And if you need, you must meet the Children's Special Health Services eligibility criteria. But they can help you with that at Families Helping Families or the BFH Family Resource Center. And that's the next thing I'll mention is our BFH Family Resource Center is a statewide resource center. They will help any family member. There's no eligibility requirement to access resources, health-related, insurance-related, can be social barriers to health-related. So there isn't many stipulations as far as what they will support. So if you have a resource need in Louisiana, the Family Resource Center is available Monday through Friday, 8 to 4. You can reach them by email or by phone. And in the report, you can see that there is a phone number as well as the BFH email. For families that need language assistance, they can text the number in the report, and just all they have to do is text the date, the time they're available, and what is the language preference. And then they will be facilitated through a language line. We also work with Families Helping Families. They're great partners in our work of supporting children and youth with special health care needs across the state. Right now, we call this our Resource Information Workshop region, season, where we host, Families Helping Families host provider education events. And so as those are, as the information on those events come available, I will share them out with the council, but they do provide continuing education credit for nurses as well as social work. Under the Bureau, we also administer the Early Hearing Detection and Intervention Program, information on their recent accomplishments and when you can attend the next advisory council meeting is within the report. They also work with Louisiana Hands and Voices, and that's a parent peer support organization for children that are deaf or hard of hearing. So if anybody has interest in that, there is a link to that information as well. And our program in our state is called Guide by Your Side. There is also the Genetic Diseases Program. This is, we do the newborn heel stick screenings in the hospital. And there's information about how our laboratories are now doing the test rather than sending them out. There's an update on that work. We also do Louisiana Birth Defects Monitoring Network for the state of Louisiana, and the criteria are listed in the report. Our Family Resource Center provides outreach to every family identified through birth defect surveillance and offers them resource and referral supports to ensure that all children are linked to the services that they need timely. We also support the Louisiana Commission for the Deaf, and their activities and contact are listed there in the report, as well as the Maternal Infant Early Childhood Home Visiting Program. We administer at the Bureau 2 different home visiting models. One is parents as teachers, and one is nurse-family partnership. This home visiting is available in every region of the state, not necessarily both models, but one or the other is available in each region of the state. And then we also have the Adolescent School Health Program that administers the OPH-sponsored school-based health centers. And there's information about that in the report, as well as contact information if you need more information. One thing for the health provider workforce, we sponsor the Louisiana Provider to Provider Consultation Line, and this is mental health consultation for perinatal populations, meaning women who are pregnant or just gave birth, and the pediatric population. So a provider in Louisiana can call at any time and speak to a licensed mental health professional and get guidance on care planning and linkage for that patient's care plan. In addition, if you need medication guidance, they can connect you with a pediatric or perinatal psychiatrist. Our developmental screening initiative continues to support Louisiana health providers with implementation of universal developmental screening in the early childhood period. So in that 0 to 3 period, we promote developmental milestone screening, perinatal depression screening, and autism screening. And so there's an email there if anybody would like more information about that initiative. We also administer the Early Childhood Systems Grant. And right now we are in the middle of an early childhood developmental screening provider survey. So if there's any providers that want to weigh in on the developmental health system, we welcome your participation. And then partnersforfamilyhealth.org, it is a great resource if you're looking for data reports. The Bureau publishes many important documents, including things like on our Louisiana Birth Defects Monitoring Network surveillance work, and that can be found at partnersforfamilyhealth.org. And then our Title V block grant team, as I mentioned, that the Bureau of Family Health administers Title V, and every 5 years we're required to do a statewide needs assessment. And so 2025 is our needs assessment year. So you may be hearing more about that. Maybe as a partner, you might be asked to participate in some sort of information gathering activity. So please be alert. We hold our partners near and dear to help us identify the priorities for this state. And then last but not least, we also sponsor the Young Child Wellness Collaborative, which is a cross-sector advisory council that provides leadership and informs priorities across the continuum of support services within the Louisiana early childhood system. We do have a family advisory committee that we just implemented in 2024. If anybody is interested as a family leader, you can email Kaylee Hall at kaylee.hall@la.gov for more information. And that's the end of my report. Is there any questions?
Any questions? No, ma'am. Any, public comments? No, ma'am. Ms. Barabecchio? Since hearing none, the report requires no action and will be placed on file. If there are no objections, the meeting will continue. The meeting, we now have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and have 3 minutes to speak. Any public comments? Oh, Mr. Taylor?
I'm talking to Ms. About the waiver act. Have they did the waiver all of, made it all into one? One thing that
Sure, so, I think what you're talking about, Eric, at one point in time, we talked a lot more about, shifting from having 4 waivers in OCD to having maybe 1, maybe 2, but a consolidated waiver. We still intend to do that. That's still a long-term goal that we're striving toward. One of the reasons we're not able to kind of move on for at least a little while is the American Rescue Plan Act dollars that I talk about us getting. One of the requirements is that as long as you're spending that money, there's something that Centers for Medicaid, Medicare Services says that you have to have a maintenance of effort. And that means that you can't get rid of or reduce or change anything that you already have in place. And it doesn't mean that if we go to a consolidated waiver that we're taking things away. It just makes it harder, and Brian may have more to say about this, but it makes it harder to show that you're maintaining the maintenance of effort because you're changing services. Even if you're not taking away, they kind of look at it like, well, what are you doing? So we have right now until December of 2025 to spend our Rescue Plan Act dollars. And so until we really get there, we can't really get back to the conversations. What we are doing though is trying to, because what folks said is it was just really hard to navigate 3 different adult waivers and then a child waiver, and now you can be child or adult. So it's just that it got complicated. When we do have updates for our services, we're trying to make the services in all either 3 or 4. With the Children's Choice, it's just a little bit different, but at least the supports waiver, the residential options waiver, and the new opportunities waiver. For example, we recently modified it so that the most of the services, the employment services, day habilitation services are the same in all 3 of those waivers. We've also tried to set it up so that people can share if they're in the different waivers. So in the meantime, we are trying to take other efforts to align them to help with the difficulty people had trying to navigate all 4 of them. Ultimately, our goal is still to get to a consolidated waiver. And the reason I say 1 or 2 is because it might look different for children and adults, but so we're having to figure that out. The other thing that we are doing that we will need to have an assessment tool that helps identify which level people would need of the waiver. And we are rolling out you guys might be selected if you're a waiver participant. We've been able to hire some temporary staff that are going to be working on this using this new assessment tool that we've developed. Over the course of the next year, there'll be, whenever somebody's plan of care comes up, we're randomly selecting folks from different areas to be able to do this, to check, they call it reliability and validity of our assessment tool. We call it the Expanded Louisiana Plus. Ultimately, we're also planning to take that assessment, which is all electronic, no more paper, just everything electronic, and use the results of that to help us with what we call resource allocation or deciding where people go. So we're still moving forward with sort of the preparations for the things that we have to do anyway to get to a consolidated waiver, but we don't have like a deadline or an exact date for when we'll move forward. And a lot of that does, some of it ties back to maintenance of buffer, but some of it ties to all the other work we need to do just to get ready for that. We are still moving that way.
About still moving to move people out the nursing home until they wait for that.
So there's two things, and Gary may want to speak to those, because we have the Department of Justice agreement, but then they also have work outside of the Department of Justice. So Gary, I don't know if you want to take that.
We have the Mike Choice Louisiana was least restrictive setting is really, we're constantly working on that. That is something that it's ongoing. We had a call actually today with the Department of Justice as a part of that, making sure that those individuals that are not using a nursing home for individuals who have a mental illness, using that as housing for someone who has a mental illness. So the Department of Justice is a part of those conversations. We're setting some new target numbers, kind of readjusting. We've been in this agreement, I think, since 2018, if I'm not mistaken. So that is something that we're working on. And they had a meeting this morning to reassess that number and look at a target number this year for 25 of the number of folks that we want to transition from nursing homes. So that is an project.
Any other questions? Thanks, everyone, for your comments, questions, and concerns. At this time, we will have announcements. The chair recognizes Ms. Ebony Haven.
I have one request, Christy. The FY 26 action plan, planning committee, they have to meet before the April meeting, so you guys can vote on your plan before we put it out for public comment. So I'm asking for volunteers for not the 5-year planning, but the next action plan for the FY 26, fiscal year 26. So anybody that would like to volunteer, please let us know now, because we're gonna have to meet before the April meeting. Anybody that wants to volunteer for the grievance ad hoc committee, you can just let Christy or myself know, and we're not gonna meet until after the session ends, after June 12th.
You saying you need to know now that
For the planning committee, yes. Anybody that wants to volunteer for the planning committee for the next action plan, I'm asking for volunteers now. Okay, so Vivian, I have you. June.
me,
Anybody else?
And the only other announcement that I have, we had tentative dates in your folders. One of them was incorrect, so we put a new one that was in the left side of your folders with the correct date. So the next meeting is April 30th and May 1st. Those are your new dates. So if you guys need anything before then, just let me or the staff know, and we're happy to help in any way we can. But I also want to just thank my staff. I know most of you don't know, but we had to pivot at the last minute. Our office manager rented our space that we were using for our meetings in our building on the 3rd floor, and he didn't tell us. So Brenton just happened to go downstairs and find the whole place gutted. So we had to pivot at the last minute. And so I just want to thank my staff for all the hard work. I also want to make sure I just mention Cheryl Madney and Deborah Whitfield for coming for your council retreat. We had a great time on Tuesday. I hope you guys had a great time, and just thank everybody for coming. You guys have a great weekend.
Thank you, Ebony. Is there any further business? Hearing none. There's no objection. We will adjourn the meeting.
we wanna thank Brent, I'm gonna call him Roman. Thank you for Roman.
You're welcome. Take a walk in again.
Yeah.
There's no objection. This meeting